love how you and Melissa are both talking about using the content to really help patients be stronger partners in their care. Even before COVID, there was so much happening and so much change in our industry, with CMS pushing us all towards value-based care, becoming a real digitized society. And even our customer, healthcare's customer, has changed so much now, with millennials, accounting for over 80% of births and acknowledging that they're the first generation of digital natives. And patient connectedness has really become central to building a hospital's reputation, patient acquisition, trust, and outcomes. And when we add to that the recognition that now 60% of medical outcomes are determined not by the care they're receiving within a hospital, but by patient behaviors and environment, where traditionally healthcare has had little to no control. I wonder, Bill, if you could talk a bit about how SmartEXP, this patient engagement technology, is normally used by hospitals to gain some of this control and the visibility and access to their patients.
Right. Well, we have a number of different service line areas that we focus on. But one of the things shared amongst them all is the objective of creating and sustaining a connection with patients as they journey through their care path. Whatever their event might be, whether that's having a baby or having a joint replacement, or even just a diagnosis that they're now coming to terms with, be it autism spectrum or COPD or heart failure. So those are all very disparate areas of medical interest and concern, but one of the commonalities is the need to connect with and support and educate that patient through the whole process. And our messaging serves to not only give people the information they need to understand what they're going through, but also help them prepare, know what to expect, and just have that ongoing sense of connection with their care providers and the ability to follow up and ask questions one-to-one if they have them as well. So I think all of those things lead to, building a sense of confidence, which we know the research says the more confident patient is likely to have, more likely to have better outcomes. But in addition to that, I think what we've seen really highlighted during this time of the coronavirus is the additional abilities of the platform to have immediate, quick connections that update the target population with specific information that's crucial at that moment in time.
What sort of engagement do hospitals generally experience for their patients who are enrolled in the program? Not necessarily talking about the COVID messaging, but in general, looking at the engagement of patients with the messaging that's going out regularly.
Yeah, I mean, overall, we have fantastic engagement rates, and we take a look at open rates for messages. We take a look at how many people have opened at least one message in a month. We also take a look at what people do once they get into the messages. Generally speaking, our client base performs well above average when it comes to open rates. There are industry standards out there, and there are clients who also use their own history to benchmark against themselves. What I really like is that we can know what engagement is like kind of at a glance, because we have the great data dashboard that's right in the platform. It's accessible by anyone who's been set up as a user, so all clients can see literally in real time how their campaigns are performing, how their ongoing series are performing, and really get a sense of who's engaged, who's not, what kind of levels we're looking at.